We're now going to learn about innovations in healthcare, which I think should appeal to both healthcare workers listening, as well as regular folks, patients that like us. Lately, headlines have again been dominated with stories of long wait times to see a doctor and barriers to innovation, despite significant investments. This begs the question about the role that technology can play to ease what ails us in delivering healthcare to patients. And so I invited onto the show InnoCare, a Canadian healthcare market leader that focuses on the development of innovative healthcare technology. Joining us on the line is Heather Shantora, CEO of InnoCare. Welcome to the show, Heather.
Thank you, Mark.
Thanks for your time. Let's start off with what is InnoCare, so we can learn a little bit about the company that you're representing.
Right. As you said, we develop technology for healthcare. An example of that would be charting electronically for clinicians. So everything that they do requires some kind of technological backbone. That's what we provide.
And what kind of reach does InnoCare have? I understand there's a lot of clinics, for example, that use your technology on a daily basis.
Yes, across the country, we have almost 500 clinics on our software, and we put through about 70,000 patients a month.
Okay. And so can you clarify again what the software does, what InnoCare software enables healthcare workers to achieve?
Absolutely. So at the core of it, we do the billing for the clinician's office, so physios, chiros, massage therapists, a few physicians and surgeons as well. So we would do their booking for them. They would chart electronically, and then we would do that billing, whether it's to OHIP or extended health benefits. But what we're trying to do is make it faster and have less administrative burden for the people who are providing the care. And if we're able to have less administrative burden on them, that means that they can treat more patients, which should reduce wait times. So what we're trying to do is really optimize the practice for them so that they're freed up to deliver patient care, which is what they want to do.
So by making the software more intuitive or streamlined, faster, they in turn can see more patients, and that's where regular folks, as I called it earlier on, could benefit. Is that we don't have to wait as long to see our healthcare professional, and then the follow-up is automated and easier, correct?
Correct, yeah. And in the last few years, the requirement for paperwork onto healthcare professionals has increased exponentially, for very good reasons. But what that means is they've delivered less patient care so that they could do these administrative things through the course of their day. If we are able to automate, for example, that paperwork, they don't need to spend the time doing it, which frees them up to see more patients.
So we're talking about software here, because I was going to ask you what would be considered innovative healthcare technology. So we're talking software specifically when it comes to InnoCare. So why would you say it matters to Canadian healthcare providers and patients? Is that because it speeds up? Again, it's more of a efficiency solution, or is it less expensive or less taxing on the facility itself?
So all of the above. I would give two examples. So one is the idea of smart wait time. So imagine as a Canadian, you're sick, you need to go to a walk-in clinic. If you were able to log into an app and find out which clinic closest to you had the least wait time, we would be able to balance the number of patients waiting to seek care. That will decrease wait times overall. Another example then is on the other side, where we need to fill out, as healthcare professionals, you need to fill out paperwork for car insurance, paperwork for workers' compensation, paperwork for OHIP. If we are able to automate that and have those forms be pre-populated for the clinician, the person delivering care, all they need to do is print and sign it. Or we've actually built an integration to some of them, so they just literally click send. That is a big difference from literally filling out, reams of paperwork, signing it, faxing it in, waiting for results. So we're really, really trying to speed things up using technology in a clinic.
Can a lot of this be done on a mobile device? Because it seems like we've been migrating from a computer-based society, if you will, to more of a mobile-centric one. So whether it's the healthcare professional or the patient, could they use a mobile device to help expedite all this and smooth it all out?
Absolutely. So the electronic charting our most recent iteration is actually meant to be used on a tablet. And that way, the person delivering the healthcare can actually go patient to patient. They're just filling out the screen, forms are automatically being completed, but it's just this tiny piece of technology that fits in their hands, but it's helping them through their day. So absolutely.
We're chatting with Heather Shantora, CEO of InnoCare. I want you to wear your futurist hat for a second, Heather, if I may, because, I just came back from the Consumer Electronics Show in Las Vegas, so I'm thinking about down the road, where are things heading? So I would like to ask you, what does a thriving and effective healthcare system of the future look like?
I think it will be one that's focused around the patient. So imagine the patient being able to log into an app and see their blood results, see the most recent things that they've seen their doctor about, see what their physiotherapist findings are and recommendations and treatment plans. All of these things gathering together into one place where they have access to all their information. That way, next time they go to the doctor, and the doctor says, okay, you've been seeing a physiotherapist. Are you better? Are you feeling better? To what degree are you better? Their outcome measures would be right there on the app. It's a world where everything would be connected for the best interest of the patient, and to make sure that two different healthcare professionals accidentally are giving diverging advice because they're not aware of the other care that the patient's seeking. We're going to put the patient at the center of everything and improve their quality of care.
I would also expect that being able to virtually visit a clinic is coming. A few minutes ago we talked about video banking, where you can on your mobile device call into your bank to talk with a financial expert. So why couldn't you talk with a healthcare expert virtually speaking, whether it's done on a mobile device or a VR headset? I would think that would be coming down the road as well, and the software required on both ends again to tie it all together, which is where InnoCare comes in. Do you think that that's something that we'll see in Canada?
It's actually already starting, and it's particularly to benefit the more northern rural areas. So, for example, in some of the more northern areas, they'll have a physiotherapist with the patient on one end of the web call, and then it will be the orthopedic surgeon who, is in the city center on the other end. And they'll actually be walking the physiotherapist through exercises they need to see. But essentially what they're doing is determining whether this patient needs surgery or not, without them having to spend, a 5-6 hour drive to come down to the city to meet the surgeon in person. This is creating huge efficiencies for the healthcare system, but also these patients. They're not well. To put them through, a 6-hour journey, for example, just to find out they're non-surgical is not helpful. So these things are being deployed. I think we're going to see it more and more.
All right. So just to recap, Heather, or a call to action, if you will, what can be done now to help alleviate the increasing demand for care among Canadian patients?
I actually think the entire healthcare industry needs to embrace technology just the way other sectors have. Your example was banking. A few years ago, and really, even a decade ago, there was a point where we all got paychecks and we would bring them and deposit them in the bank. Now we use our mobile app for everything, and it actually shares information between competing corporations. Why can't we bring this to healthcare? Why can't we have integrated healthcare on an app or some kind of easily accessible device where it's a clearinghouse of information between all the clinicians you've seen? This is coming, and it's going to be very exciting. But I do think it's not that far off, and the call to action really is on companies like mine to make these options available to both the patients and the treating therapists. Mm-hmm.
With that in mind, is there a website our listeners could visit to learn more about InnoCare and InnoCare charting if they're a healthcare professional or they work for one?
Absolutely. So InnoCare.ca. From there, it's got a variety of our different products that help make efficiencies in practice so that we can treat more Canadians and get them better faster.
All right. Heather Shantora, CEO of InnoCare, thank you very much for your time.
Thank you, Mark.